Hi, everyone. Dr. Sheftal again with Truth in Science. Tonight's presentation is going to be on the vaccine, and it's going to be in a question and answer format, which I got a lot of positive response to last time I tried this format. Again, this is the bona fides page, which we'll skip. So let's get started. And again, it's in a question and answer format. And I created some of the questions myself just to help people understand this topic. It's getting a little bit complex now with the vaccine. And so I tried to create some questions that would help people understand it. So the question is, I saw Dr. Fauci say on TV yesterday that the vaccine does not prevent you from spreading the virus to other people. Is that correct? Yes, Dr. Fauci is correct. Getting both doses of the vaccine and waiting the obligatory 14 days to mount an antibody response does not prevent you from spreading the virus to someone else. And if you think about it just a little bit, that's going to also imply that getting the vaccine does not prevent you from getting the virus yourself, because you can't spread it to someone else without getting it. So just to repeat, the vaccine does not prevent you from getting the virus and spreading it. So I made this little cartoon here to explain how this could happen. This is a young father here in the blue mask with his mother here, his little baby here, his wife here in the green mask. And he gets his family to get the 2 doses of the vaccine and wait the 14 days. And as you can see, they all have a swelling on their shoulder where they got the vaccine. And the baby's crying. And I can tell you from personal experience that children do not like to get shots. You can't tell if the father and mother are smiling, but they probably are, because they know the family's protected. And grandma's expression rarely changes. Then the father goes to work and the doorman at his company infects him, okay? Now, he goes home still thinking the family is protected after a promotion. He's very happy. And he infects his mother and his wife, even though he's wearing a mask. And of course, grandma's expression rarely changes. And we don't know what the wife's expression is. Of course, we don't know that she's infected yet. You know, the father's infected because his body has turned red. That's what I mean about the red body now, from black to red, means he's infected. And the baby, luckily, has not been infected at this point. So 2 months pass and grandma dies. And at the funeral, the father is present and crying, very unhappy. The daughter-in-law is crying, very unhappy, and the baby has now gotten infected, and we don't know how. It could have been from the mother, the grandmother, or the father. Finally, the father hears Dr. Fauci say that on television and realizes that he could have infected his entire family after he got the vaccine. And of course, that's a horrible burden to bear for the father. And that's the end of that little cartoon. Okay, but that can happen in real life. Question number 2. So even after we've gotten the vaccine, we're going to have to wear masks. It appears that the government will still make you wear a mask after you have gotten the vaccine, even though it's been shown by 72 years of randomized controlled trials, 74 counting last year, that masks do not reduce the transmission of respiratory viruses, period. The government does not seem to have understood that, and they are still mandating masks in some areas or strongly encouraging them. What about after everyone gets vaccinated? Would you still have to wear a mask? Well, first of all, it's impossible for everyone to get vaccinated. Many people will get medical waivers for a number of reasons, dozens. For example, a history of anaphylaxis. Other reasons people won't get vaccinated is because the there are many people in the far corners of the earth that won't know about the vaccine or be able to be reached to get the vaccine. There will also be a lot of people who refuse the vaccine, including quite a number of medical personnel have already refused it. But even if everyone got vaccinated, nothing would change because the vaccinated can still get infected and still spread the virus. So they may still mandate masks. Another question that has come up quite frequently is, why are the airlines saying we have to show a negative test or be vaccinated before we can get on a plane? It seems a little bit illogical because the people that are vaccinated can still spread the virus. And if you haven't been exposed to it yet, in other words, if you show the airline a negative test, you're getting on the plane with vaccinated people who can spread the virus to you. It doesn't make a lot of sense, frankly. But that is their policy right now. Now, we know that it would make a lot more sense to let people on planes who have already recovered from the virus, because we know that only 24 out of 800 million people worldwide have gotten the disease 2 times. The disease now, not the vaccine. The vaccine does not protect you as well as getting the disease does. Even though Dr. Fauci has said that on TV, he's not correct about that. There's a little bit of wide eye opening when I tell that to people, that Dr. Fauci's not correct. But it makes no sense to think that getting a vaccine that doesn't even prevent you from spreading the disease or prevent you from getting it is more effective than getting the disease when only 24 people out of 800 million have gotten it twice. I don't know what else to say about that. Okay. Surely they let us get back to normal when we reach herd immunity. No? Says who? We're being vaccinated for last year's variant right now. There are already 3 new variants in the world, and it's impossible, obviously, to keep them out of the United States. We learned that last year. So one of the new variants, which supposedly spreads, is much more transmissible than the 2020 variant, is already in the United States. That's the British variant. The South African variant will surely get here, and it spreads faster than last year's variant. And also, it's a little bit more different than the British variant. And even though we've been told that our vaccine probably works against the British variant, there are hints that it may not work at all against the South African variant. And remember, when I say works, I'm talking about reducing the severity of the disease, not preventing you from getting the disease or spreading it to other people. That doesn't even work for the American variety, if you will, with the American vaccine. It's a shame that that's the way things are coming out, but that is what's going on. And by the time, say, half of the Americans get this vaccine that's being promoted right now, one of the other variants will be the predominant variant in the United States because they spread much faster. And we know that the virus only takes a few months, or last year's virus only took a few months to go through the whole population in the region in which it was active, such as the Northeast first, then the South. You know, it went through in a couple months, each of the regions. And if the other variants are more transmissible, like they keep saying, they're going to spread through the United States very, very fast. Okay, less than 2 months per region, for example. And then there'll be the predominant virus in our country, and the old vaccine may work partially against the British variant or the Brazilian variant, or maybe even the South African variant. We don't know yet. But is it going to be 60% effective? Is it going to be 35% effective? We don't know yet. So they're probably going to formulate a new vaccine and require everyone to take the new vaccine also. Probably they will do that. Okay, here we go. That's question number 6. Are you saying we're going to have to get another vaccine? Yes, you're going to have to get another vaccine in all likelihood for the other variants. Otherwise, we're never going to achieve herd immunity to the new variant, because the old vaccine is not going to be 96% or 95% effective toward it, because these spike proteins have mutated. Okay. Then the imaginary questioner asks, but I thought this vaccine worked against the British version. And I go, what do you mean works? The version doesn't even work against the 2020 American version. If you can still get the virus and still spread it, except that it does reduce severity in 95% of people, although strangely, it has not been shown to reduce mortality even. Okay. Then I let my imaginary questioner get a little frustrated. Come on, do you have any proof that it doesn't prevent you from getting the virus? Sure, I have lots of proof. First of all, the vaccine trials, remember those? They did not test for whether the vaccines prevented reinfection. They only recorded trial participants as positive if they exhibited symptoms after the vaccine. And we already know that 40% of the people who get infected don't exhibit any symptoms. Those people would not have even been noticed in the trials, because they only check for people who got symptoms. Secondly, we have done swab tests on people who have already gotten both doses of the vaccine and waited 14 days after the second dose. And in the swab tests, we're getting virus. So people are getting infected after they completed the dose 1 and dose 2 regimen of the vaccine and waited 14 days for the antibody response to declare itself. They're still getting infected. Okay. Then our imaginary questioner decides to change subjects. Do lockdowns work? No. Unfortunately, and I mean unfortunately, it would have been great if something had worked. Masks didn't work, lockdowns didn't work. The virus just naturally spread through the population, like I've said, since March. Okay. No, unfortunately, the data show that lockdowns do not work and may actually make the virus spread more effectively by keeping everyone indoors. I mean, can you think of a worse idea than bringing a college student home where he got infected at college but didn't even know he was symptomatic, to live at home with grandma and infect her, through a lockdown? Very bad idea. Lockdowns were probably the stupidest idea in the history of medicine, right up there with bloodletting. When you got sick a long time ago, they used to actually cut your vein and bleed you out, which of course is exactly the opposite of what you want to do when you get sick. You want to get a lot of oxygen around to your tissues, which is what the blood does. Lockdowns will cause roughly 1 million times as many deaths as would have occurred if they had not been instituted. And I've covered this in great detail in my previous videos, which I would love you to go watch. I talk about all the different ways that people are going to die from the lockdowns and suffer. It was a horrible idea. But didn't lockdowns work in Wuhan, China? I saw videos of the whole city celebrating in a big party a few weeks after their lockdown. Okay. The data show that lockdowns did not work anywhere in the world and cannot, because of the nature of the virus. It's too small. It's 100 nanometers in diameter. It literally blows in through the cracks in the door. It also carries on a waft of air when people speak. It can travel 36, 40 feet, not the 6 feet, which was totally arbitrary that someone thought of at the beginning. And this virus is very infective. So if you're in a room with someone, even if you have a mask on, the virus is billowing out in plumes around your face, and it's going to fill the room like cigarette smoke does. And it's very similar to cigarette smoke as far as whether people are breathing it in or not, a great distance from you, whether they're wearing a mask or not, or whether you're wearing a mask. If you can smell cigarette smoke, mask or not, you can inhale the virus. Okay, so just think of it that way. If someone is smoking and you're 25 feet away from them and you can smell the smoke, believe me, you can get infected with the virus, mask or no mask. Of course, you can smell smoke right through a mask too. And the particulates in smoke are 4 times larger than the virus. Okay. Just think about it for a second. What happened in Wuhan? This is a photograph of the citywide party that occurred there. No one believes that lockdowns cure the disease. Of course they don't. They were only put in by some low resolution thinkers to flatten the curve, okay? Reduce the rate of transmission. Nobody thought they were going to eliminate the disease, even the people that were dumb enough to think they would flatten the curve. So even after the lockdowns were over, right, people still had the virus, right? Okay. Letting them swim together like this would have never happened, okay? So there was something a little strange going on here, okay? Why they showed the world that the lockdown had eliminated the virus. And then, of course, the Western doctors fell for it and the politicians. Just incredible. For some reason, the politicians in the West took these pictures and China's word for it, that lockdowns work to completely eliminate the virus. Our medical advisors were clearly lacking in the reasoning department. No question about it. If they thought a lockdown would completely eliminate the virus. Okay. Even if lockdowns had worked in the way that they were thought to maybe work, or thought to work by reducing the spread and flattening the curve and all these silly expressions they came up with. If any of these people in here had still had the virus after the lockdown, it would have spread through the entire city, okay? Among the people that were vulnerable to it, susceptible to it. Now, of course, the entirety of Asia has a lot of immunity in place because of cross-reactivity with previous coronaviruses. I've talked about that a lot. And actually, quite a few people in America also have that protection. This is why not everyone in the nursing home gets it when 2 or 3 people get it and breathe for weeks in the nursing home and then die. Some people don't get it. Why? Well, it's because they have immunity in place from previously encountered coronaviruses. And I don't know if you notice this or not, but not a single one of these people at the citywide Wuhan celebration party a couple of weeks after their lockdown ended was wearing a mask. Now, I let my imaginary questioner get a little frustrated. Well, wait a minute, Dr. Fauci is America's leading infectious disease specialist. Yes, I've heard him introduced that way many, many times, and I certainly have no evidence to prove that assertion wrong. And I asked the questioner, do you have any other questions? Yes, I do. I watched your video on hydroxychloroquine combined with zinc and ivermectin also. You showed studies that show they actually work, but many studies were done that showed they didn't work. That is correct. The studies quoted by Dr. Fauci and the other TV and bureaucratic doctors did not address the population of patients claimed to benefit from those medicines by the clinical doctors who had treated hundreds and a few in the thousands of SARS-2 patients without a single fatality. The studies quoted by the bureaucratic and TV doctors were done on very sick people in the hospital instead of the population that was claimed to benefit. High-risk patients in an ambulatory setting, okay? Those studies also neglected to add zinc to the mix and used doses of hydroxychloroquine that were as much as 4 times the recommended amount, leading to very severe side effects, which hydroxychloroquine ordinarily does not have associated with it. Hydroxychloroquine has been used for 65 years. It's over the counter in most countries. It is I think it's called something like the Sunday fix or something in Africa, because there's a lot of malaria there and everybody just takes it all the time to make sure they don't get malaria. And by the way, that's one of the reasons that Africa has been largely spared from this entire pandemic, in my opinion, is that they all have hydroxychloroquine on board. Okay, let me continue on here. So all of the studies that were claimed all summer long, all spring and summer long by the so-called experts that supposedly prove that hydroxychloroquine and zinc did not work were all designed improperly, lacking zinc in very sick patients in the hospital. And by the way, one of the mechanisms of action of hydroxychloroquine is to reduce cytokine release by the T helper cells. And if you get the patients late in their course, they've already released the cytokines. And so the hydroxychloroquine is not going to help if the cytokine storm has already occurred, leading to fluid in the lungs. That's why it might be effective in very early patients, ambulatory patients, meaning patients that are high risk walking into their doctor's office to be treated. They have symptoms or they wouldn't have gone to the doctor in the first place, but it's very early in their course and there has not been enough time for the T helper cells to release the cytokines yet, which causes fluid in the lungs. Okay. And also those studies, as I said above, used as much as 4 times the normal dose, created all kinds of side effects that don't occur in patients normally treated with hydroxychloroquine, which include systemic lupus erythematosus patients and rheumatoid arthritis patients, for example. And these patients take hydroxychloroquine for years without any side effects, by the way. We're talking about just giving it for a couple of weeks in the case of SARS-2, because it's a virus that only lasts a month or so. Maybe you give it for a month. Okay. In the last video that I made, I showed a couple of studies that were designed properly, and they showed that hydroxychloroquine and zinc and ivermectin were very, very effective and eliminated an enormous amount of the deaths, like 75% compared to what was expected. Hospitalizations reduced by 90% in the patients taking these medicines compared to what the Cleveland Clinic, the Cleveland Clinic's model indicates that patient group would go, like, let me just give you the numbers, it's easier, I'm sorry. 18.7% of the patients in that cohort of slightly elderly patients, not elderly, over 50, with a comorbidity, ambulatory, 18.7% should be hospitalized according to their formula, but only 2% were hospitalized that had this hydroxychloroquine and zinc or ivermectin cocktail before, or when they came in as an ambulatory patient. So that's a 90% reduction. And the deaths were reduced by 75%, just an enormous reduction in deaths. Since then, a judge has ordered a hospital it has forced a hospital to use ivermectin. A judge had to intervene and overrule the powers that be that were not allowing it to be used. Finally, my imaginary questioner asked me if I'm going to get the vaccine, and right now I'm not going to do it. The more I learn about it, the more I hear about that concerns me. And one concern I have is antibody-mediated enhancement, which is a true phenomenon. And if you've watched my videos and listened to the immunology primers, you will know that the immune cells, such as monocytes or macrophages, can endocytose, can take in a virus antibody complex because they have Fc receptors on their surface, and the FAB portion binds to the virus, and this gets pulled into the immune cell. Now, if there are a lot of antibodies around, this will damage the virus's ability to replicate. But if there's an inadequate amount of antibodies around, the virus can be pulled into the immune cell and actually use the immune cell to replicate itself, which means that this is why it's called antibody mediated enhancement, which means that if you vaccinate a group of animals, let's say, let's leave it to animals for a second. If you vaccinate a group of animals and then give them the virus to see how well they do based on their vaccination, many of the animals will die. As a matter of fact, in a study in SARS-1, 30% of the animals died because they had more trouble with the virus after being vaccinated because of this phenomenon, okay? Because the antibodies that were present, which were inadequate in number, actually helped the virus replicate. And so more animals died than in the group that were not vaccinated, okay? That concerns me a lot because we didn't do animal studies in the vaccine trials for SARS-2. And that has me worried. And there are a number of other things, but that's something that I've really thought about lately, and very disturbing, you know, that we just skipped the animal trials, in my opinion. Okay. So again, this is the second to the last slide. Tonight's presentation is a little shorter than I normally do. Get your vitamin D levels in order, get your blood sugar in order, stay slim, and think really hard about this vaccine. The disease has a very, very high survival rate, as we know now. We didn't know in the beginning because all the experts were wrong, even though I was screaming at the top of my lungs that their infection fatality rate was wrong. But anyway, just think about this long and hard, and take care of your metabolic parameters and stay healthy. Get out, get a lot of sun, and talk to your doctor about this, heart to heart, about whether it's a good idea to get this vaccine or not. And follow the news. Even though the news is sometimes very misleading, try to get the raw data and see how many people are having trouble with this after they've gotten the vaccine. How many people are getting infected after they've gotten the vaccine? What are the side effects? All sorts of strange side effects have come up recently. 36 people have died in Norway, for example. But please look into all of this stuff. There's an awful lot of politicism, making medicine political, let me say it that way, over recently in the last, say, year or so since this has begun. And it's very upsetting to me. And it's something you need to watch out for, because clearly there are unusual forces at bay here that play here that normally are not in medicine. It's been very upsetting for a lot of doctors to see this happen. So look into everything carefully and make an educated decision, and speak to your personal doctor, please. So thank you again for listening, and I'll see you down the road. Thank you. Oops, I'm still a novice at this. Sorry about that, everyone. Okay. Bye-bye, and I'll see you down the road. Thanks.